So, looking back at how things are now, I really appreciate where things, how far we've gone as a people and how far we've achieved through democracy. But it's also sad in a way to see now how we are abusing that very democracy we have achieved, and how our young people now don't appreciate how much other people have fought for them, because those hindrances are no longer there. Now they have all the opportunities. They have phones, cell phones. I only had my first cell phone at varsity. That was the first time I had a cell phone. And even then, it was a limited, non-digital, big device, thing like this. Yes. So we used to have paper library, and we used to read paper books. Now they have all this access, and yet they still don't want to study. They still don't want to achieve bigger dreams than what we had. But there are a lot of things you don't understand when you're a child that you only understand when you have your own children. I think motherhood is definitely one of those things. You can only understand what it's like to be a mother and appreciate and forgive the negative things that happened, whatever you think was traumatizing you, Children now, they think they have childhood traumas. They don't know what we went through. And now studying when you are a parent and you are in private practice, which is like you running a business, is totally different than when you're young and free. That was the main challenge, how to balance everything up. I have to work from 7 to 5 every day. I have to come back from work and study. And when you do a PhD, you have to literally read every day. I worked it out because I have to read 3 articles a day to cope with the amount of reading I have to do for my literature review. For every chapter of the book you have to write, and for every article you have to write. I had to again go back and be disciplined and work out a schedule and stick to it. Yeah, that was the most challenging thing. Doing the degree itself was not difficult, and I tell youngsters now, doing a PhD is not about level of complexity. It's about time management. It's not difficult. Anybody can do it.
Sanbonani, hello, hi, and welcome to the Top Woman Podcast, a show where we look at the behind the scenes of the powerful women who have paved the path for others to follow. My name is Zamaki Meklu, and we are at Nomusa's B&B, setting up a warm, cozy environment for our next guest today. We're sitting with a woman who has been resilient, who has stood the test of time, and we might say she's a hero or warrior somewhere there. Dr. Mazibuko, how are you?
I'm well, thank you so much.
Thank you so much. You look beautiful, by the way.
Thank you.
Yes, I use resilience when I speak about you, because I'm looking at your profile and I'm getting to know you more, and the viewers at home will too. But you grew up pre-apartheid,
yes.
And you had to move, your family had to move because of all those traumas that were going on and the challenges that were going on in South Africa before 94. Can you just take us back, being a young girl, growing up in the environment? How was it for you?
Okay, thank you for that wonderful question. I actually, now looking back, appreciate my background and the fact that I know what apartheid used to look like, and feel like I wasn't that old to participate in any activity by any chance. But I observed and watched how people were treated back in the days when apartheid still existed, when there were still toilets, no blacks and white only. I remember as a young child, I was sick and my dad took me to see a doctor in Newcastle. And we were told, this was a white doctor, why sit down in Newcastle, and we were told to use the back door and not walk in through the front.
Oh my God.
Because the front was reserved for white people. And there was a nice waiting room with beautiful couches like these ones. And when we go back to the back, you enter through the kitchen and there are just benches there. And I asked my dad, why are we asked to sit here when there's another area to go in there? And he says, hey, this is how things are. My dad was a person of small words or a few words. It's just that this is how things are. When you are black, you go through and wait here. And I remember when we walked into the doctor's rooms, there were jars of sweets on his table, like doctors would have for children and give. But he didn't give me any sweets. So now, because I remembered the question I asked my dad, why are we asked to sit there? So I wasn't going to ask, why didn't he give me sweets? Because I could see there were sweets on his desk. But I was not privileged. So looking back at how things are now, I really appreciate where things, how far we've gone as a people and how far we've achieved through democracy. But it's also sad in a way to see now how we are abusing that very democracy we have achieved, and how our young people now don't appreciate how much other people have fought for them, because those hindrances are no longer there. Now they have all the opportunities. They have phones, cell phones. I only had my first cell phone at varsity. That was the first time I had a cell phone. And even then, it was a limited, non-digital, big device, thing like this. Yes. So we used to have paper library, and we used to read paper books. Now they have all this access, and yet they still don't want to study. They still don't want to achieve bigger dreams than what we had. So yeah, that's how I grew up. But again, there were a lot of good times as well.
It is very fortunate for us to actually have a conversation with someone who was in that area, who was still young, who was still curious to find out why are things a certain way. Because usually when we talk to people from that era, they had already grown accustomed that this is the way. With that general curiosity, you started grade 1 at the tender age of 5. And after that, you skipped grade 2 completely and you moved to grade 3. Did that skip, that change, did that in any way or form give you that sense of character that you do belong in bigger rooms?
It actually didn't. First of all, it was because my family couldn't afford preschool that I didn't go to grade R, and they just sneaked me into grade 1. So, but I always loved learning. So when I was put in class, I was so excited because this was the first time I was learning in a learning environment, and I loved it. I loved going to school. I think that's why my teachers observed, this one is Yambambezela, So I started grade 1, and in the middle of everything, they just realized this coloring is just wasting my time, and moved me to grade 2 in the same year of grade 1. That's what happened. So by June, when we came back, I was put in a new class.
Okay. Wow.
And then by the end of the year, when I had finished grade 2 in that second semester, then I moved on to grade 3 and moved on to grade 4. In fact, because I didn't go to preschool, I was too young. I was 5 when I started school. And then the skipping of a year made me too young to be even in grade 4. So at that point, Nakona, they wanted me to skip a year. Back in those days, the education system was different. I don't know how much different, because I wasn't adult enough to appreciate the content, but it was easy. Well, it did appear a lot of us we had to go through the system. I think anyway. So because of distance between home and school, my mother said, no, don't take her to another school, because if she skips a grade, she has to go to another school, which was a section, in another section. Yes. So grew up in Newcastle, my dad didn't. So and so that's how it happened. So I didn't appreciate what it meant at that stage, because I just wanted to learn. And for me to learn more and to go to a new school, it was all exciting. My mom loved education, so she made sure we prioritized it as well.
So as you're speaking of your mother, you had to go through a major change where your mother now had to move. She got remarried and you were left with your grandparents. Now, as a woman, now at your age, do you understand the sacrifices that she made?
Yes, actually, my mom had me before she got married. So
Okay.
now then she got married to my stepdad, and that's how we moved to Newcastle because he worked there, got ISCO. Yeah, no, you know what? When I was growing up, things were tough, and I always wondered, what are we doing here in this crazy cold place? Why are we here? But there are a lot of things you don't understand when you're a child that you only understand when you have your own children. I think motherhood is definitely one of those things. You can only understand what it's like to be a mother and appreciate and forgive the negative things that happened, whatever you think was traumatizing you, you know. Children now, they think they have childhood trauma.
Traumas.
They don't know what we went through. Because getting a beating, a proper beating, was normal.
Not a spanking.
Not
a
not a
beating.
spanking, like a
Not a
proper
time out.
beating. This soft parenting thing didn't exist and would not have, because you get a beating at home and then you get a beating at school. A proper one on your knuckles. So things were tough. But you know, when you're old and you have children, you appreciate those tough times taught you something. I always tell my kids, you know, we walked to school. Nobody gave us a lift. And there was no taxi or e-transport.
Staff, yes, things
And now,
like that.
when I'm late to pick them up, you know, my daughter used to be so upset. I was always late because of work to pick her up. She was so upset. And I said, why didn't you just walk home? Because you could have walked. Now I used to walk 5 kilometers to school every day in rain and sunshine and winter. Even if you know Newcastle, you know how cold the winter is, and you leave home around 6 to get to school at 7, you walk an hour. So but those tough times were, really taught us resilience, and really taught us you can go through tough times and still win. And in fact, it motivates you to say, I don't want to be in this environment. I need to get out of here. I need to be independent. I need to have choices in life so that I can choose to stay here or go there, or go to this doctor and not this doctor. You know, you learn to, it motivates you. And without motivation, as we can see now, a lot of children feel entitled to things, and they don't see the need for hard work because the things are already available. Yeah. So definitely taught me a lot about discipline.
Let's fast forward now. You are in grade 11 matric. This is the dawn of a new freedom for South Africa. There's great changes. There's excitement in the air. Now you're at the age, you were 16. So your cognitive thinking, you already know what's going on. You see what's going on. You've seen the struggles that people have gone through. And now you're in matric. Then after this, it means it's a new beginning. At what point in time did you say to yourself during that final year, you know, during the dawn of, I call it the dawn of a new day in South Africa, did your dreams change? Saying, now the possibilities are endless. South Africa is changing. It's opening doors for all races. Did your dreams change? Did your way of thinking say, when did you say you even want to be a doctor?
I was in matric in 1994, and we were hopeful. I think more than anything, we didn't have dreams, we just had hope. You know, because before this we were surviving. But you didn't have dreams, you just found a way to survive. Every day was about surviving. This day is finding food for this day. This month is over, now what's next? This year is over, now what's next? And that's how we were surviving. So 1994, I was in matric, I was hopeful. I remember I was in a very difficult situation because my mom, again, because of her love of education, decided when I was in grade 10 that she was moving me into this multiracial school because now it was open. So when they said children can be enrolled in town, that's what everybody said. So my mom went ahead and yanked me out of the township and put me in this strange environment where we had to face discrimination head on. I think parents, because my mom and her friends all did this to us. And we felt like we didn't have a choice in the matter.
Obviously.
Your parents decided what's
For you,
happening, and
yes,
that's
you
what
just
you're
do it.
doing. So we were yanked from our usual school, friends, common people, and now we had to prove ourselves. That's what I learned when I was in that environment. Firstly, I had to learn fast and adapt. Because I'm in a new environment. These teachers didn't have time for us. They were not happy about this change. And I didn't know Afrikaans. Well, I thought I knew Afrikaans because my Afrikaans teacher was very proud, but we only had het gegaan. That's what verlede tijd, toekomende tijd. That's all we
The
knew.
basics, yes.
And now this teacher in my Afrikaans class says, when it's Afrikaans, I do not want to hear a word of English. So when it's an Afrikaans period, you need to speak Afrikaans from the beginning to the end of the hour. And my Afrikaans, it may my head.
Yeah.
So I had to adapt. I realized, I had to pull up my socks and I have to work hard to make it because this is my life. I had to take charge to say, I really need these results, the grade 11 and 12, for the future, which I don't know.
What it's like.
But what I know is I have to work hard right now and adapt to this environment and win. And prove myself to these people because I can see
You need to show them.
So it was hard work. And you had to come up with a strategy how to cope and how to avoid things that don't matter. As a young child, as a teenager, like you said, I was 15 at the time, only 16 in matric. But I had to realize how to prioritize and what to take notice of and what to ignore. There was no time for mjolo. I had to focus on my studies and I had to focus on this Afrikaans.
That you now need to know.
And the maths, the gap, because we were taught in a different syllabus. Remember, we're in the Bantu education. And now Sesiki multiracial, so there was a big gap in our education and our readiness for matric. So I had to take extra classes. We go to one of the teachers' homes and on the weekend to study, and it was tough. So it definitely, again, taught me discipline, self-discipline, because nobody could help me. Even my mom, the same mom who took me there, she couldn't help me with this maths. I had to come up with a way.
Yes, how?
So adaptability, flexibility, and discipline, I think were definitely what I learned in high school, and I had to learn. And to manage discrimination, I was the only black person in my class in high school, because that school only took a couple of people to show that they're integrating. So they spread us out. So in my class, I was the only black person. And as a result, so when I went to the University of Durban, Westville, the next year, we were a class of 20. There were only 3 of us in a class of 20 again. So my high school prepared me to for that bigger picture. Now at the varsity again, there was still the process of transformation. Yeah, because we were the group that were a result of being accepted because of transformation, like they're doing us a favor. So again, you're in an environment where you have to prove yourself, which I'm worthy of being here.
It was a lot. So I'm sure that it did definitely prepare you for university. So I want to skip forward now.
Okay.
You're doing your honors in speech hearing.
Yes, it was Bachelor of Speech and Hearing Therapy, which was an honors degree because it was a dual qualification back then. So you're doing 2 degrees in one, and then after 4 years you have honors. Yes.
Is there any part in your clinics or your patients' interaction that made you think, I want to do this for the rest of my life, or a moment that was memorable for you?
Actually, I had planned to get out of this as fast as possible. At that time, I didn't see the bigger picture. No, I wanted to get out of this. I was like, what's going on here? This doesn't have money, clearly. And I looked at I remember I looked at the newspaper for job positions. You know, they used to advertise jobs on
classifieds.
the Sunday
Yes,
Times.
yes.
Then you see how much do these people in this career
Actually
earn?
get paid.
And I'm
Yes.
like, this is not a lot of money. I'm in the wrong field. I need to get to engineering where people are getting all those thousands of rands. No, I didn't see the bigger picture at all.
And then you now move now, you graduate.
Yes.
And then Dr. Mazibuko deciding to be Dr. Mazibuko. 10 years later,
Yeah.
you decide to continue and you had your MBA done. But now I need to understand, because it's not usually something a therapist would major in, because it's a business major.
Yes.
What made you take that distinction itself?
Again, you know, God has a way of working things out. And so when some people believe in you, you get motivated to say, why not? I can do this. I can do this. Because even from finishing the bachelor degree and doing my master's is because one particular lecturer, Umershan Pillay, I always remember, he was a very nice guy in my junior degree, and he said to me, he called me after graduation and says, you must register for a master's. I said, what? And he says, no, you must register for a master's, I'll help you. So it's just to have somebody who believes in you is a big push in one's life. And, you know, and I was motivated by that. Oh, if he thinks I can do it, then I can do it. Yeah, well, so that's how it happened. And so when I finished that first master's in speech therapy, my husband was doing MBA through UKZN, and I was seeing what he was studying, and I was like, how? I can do this MBA
as well
thing.
Yeah.
So when I finished my initial master's, and I felt this is not taking me to where I want to go. I feel there's a lot I still don't understand. Simple thing is, for instance, when I watch the news, at the end of the news, they used to have this economical report.
Yes.
And they talk about the exchange rate and everything, and it didn't have any meaning to me. I didn't understand, what are they talking about? What is this? And that was actually the reason I wanted to do MBA. I wanted to understand how money works.
Yeah.
And how to make it in business, because I realized with our undergrad health degrees did not prepare us for the business side of things. I was already in private practice, and I didn't know a lot about money and how business works and how tax works and why we tax so much. So that's why I did it.
And then you move now from, you get your MBA, and then you say, no, I am not done. You get your doctorate.
Yeah.
During that process, and now this is the Tsochazobomvu, that is has a lot of challenges. Was there at any point where it felt like you can't do this, and how did you take yourself out of that pit?
Oh, okay. Actually, I realized when I registered for a PhD, you know, before I registered for a PhD, the motivation was I already have 2 master's degrees. So what's the difference? I saw it as it's just the next step. I'm sure at this point I have the skills to manage that. Like, remember, you asked me earlier what I learned from those tough times in high school, early years, adversity. By this time, I was confident because I can do anything. So registering for the PhD was the next thing I beyond which there's nothing else. So why not? And there were opportunities I heard about. You can get funding for this thing and do it for free. So I was like, okay, that's the next thing. There were challenges though, because I had to keep my day job and study. And now studying when you are a parent and you are in private practice, which is like you're running a business, is totally different than when you're young and free. That was the main challenge, how to balance everything up. I have to work from 7 to 5 every day. I have to come back from work and study. And when you do a PhD, you have to literally read every day. I worked it out because I have to read 3 articles a day to cope with the amount of reading I have to do. for my literature review. For every chapter of the book you have to write, and for every article you have to write, I had to again go back and be disciplined and work out a schedule and stick to it. Yeah, that was the most challenging thing. Doing the degree itself was not difficult, and I tell youngsters now, doing a PhD is not about level of complexity, it's about time management. It's not difficult, anybody can do it.
And I think you've achieved it because now you've been in the speech and audiology field for 25 years. That is a quarter of a century, you know. What has kept you anchored to that field?
Funny enough, I started the career and I didn't like it, and I thought it was boring and there was no money. And then I fell in love with aspects of it. I realized, but you know what, I don't have to like the whole thing. I have to find my passion within it, which is what nobody prepares you for. When you choose to be a teacher, you don't have to like all the aspects of being a teacher, but find something that really sparks joy when you teach and stick to that. So I decided actually it happened when I worked at the remedial school. I realized actually I like working with older children. What I don't like about this job opportunity is the little kids. But I like school age. I like I like helping people learn. So when I worked with children with learning disabilities, it really made me happy. It gave me a sense of achievement. And so that sparked into it. Okay, let me specialize in this. And let me see how I can turn this around, in fact. Yeah.
So with that, and I love how you're talking about passion being the pusher.
Yes.
With what you do, you basically change a person's quality of life.
Yes.
You give them a voice. Have you ever encountered a patient, without mentioning names or anything, breaking confidentiality, but have you ever encountered a patient where after your session you went into your car and you broke down?
No. Because I always do my best. I always have a sense that I've done the best I could for this patient. But there are cases that have touched me, especially when I used to work in Gwelezane. Because you see very wide range of conditions, and you would see the worst kind of cases, if I may put it like that, because of the net. You see people from all over the northern KZN, because Ngwezan is now a tertiary hospital. You get patients referred from all over Jozini, Guapoma, and sometimes you really see and feel responsible for helping somebody because they've been done wrong by the system. So there have been many times when I see a patient and I'm like, I can see you've been dealt with in an unjust way. How can you get here and only now we identify this problem? So I have to do my best to change your world, kind of a situation. So there have been a lot of times when I see children and I could see if I had only seen this child when they were still in grade 1. Now they're in grade 7, they can't read. Now I can't focus on teaching them to read and write, so now I have to teach them coping skills. But I still do the best I can in this situation so that their life can change for the better.
I love you spoke about the passion that comes through, because I think in the field that you're in, I'll be honest and think, especially as speaking as a demographic that is not always taken care of, it's that issues like that with speech or with what you do, audiology and everything like that, it's not seen as a common sickness. So even when parents were to identify it, it's not something that they'd rush to take care of. Some institutions, like you say, they'd go in, and if you had a cough, it would be easier because I could give you a paracetamol and aspirin. But you have a hearing problem, or the parent is explaining. Sometimes the parents don't even know how to explain. How important do you think it is to actually teach people about what you do?
It's very important. It's been my goal since the beginning, because we've always been a minority as Black people in this career path. We've always been a minority. It used to be a white people's only thing. Even the institution that train speech therapy from back in the days, they only used to take white people until our times when we started. And now UKZN really led in making sure that we have more African, more Zulu speaking therapists trained. So, and then our task even during our training was to make sure our community knows what we do and why it's important. And even now, as much as there's education and information on the social media, there's a lot of misconception about what's the importance of speaking fluently. And I can never emphasize it enough because I've been judged based on how I speak. So I tell people, how you speak is your first impression. So if you're unable to communicate and express yourself, people think you're dumb. If you're speaking funny, you have a lisp or something, people think you're disabled. Or even your brain doesn't work. Just because you can't hear, then it means even your brain doesn't work, you're stupid. So it's very important for families to understand that your ability to express yourself is your weapon. And back in the days, we used to have to fight for a lot of opportunities. And now in this digital world, really communication is your weapon, so you can fight for yourself.
Can you give us any identifiers? Because I speak about what you do because it does touch me close to my heart personally. Because my son is 4 years old, and there comes a struggle within the family, and you say he doesn't speak the way his peers would speak. And then your parents will say, well, you were slow as well. You'll speak at 5. It grows into you. At what point in time should a parent, now we're talking because you mentioned the fact that there are certain issues that if they had been identified at a younger age, we wouldn't have gotten here. Because you can hear that he is trying to communicate, and in his mind, he is speaking fluently. It's just that the words, when they come out. And then obviously now we're in a different space where our kids do go to these Model C schools, as our parents used to call it. And they will tell you that, well, there is a speech therapist or you should take your child there. But all the family or part of the family still believes that it's normal, How do you tackle that, and how can we help younger parents identify those issues?
Firstly, I think the important thing for people to understand is early intervention makes a big difference in the quality and the amount of outcome that you get. So the earlier you act, the better for anything. The earlier you that's why it says it's not important when you start, but when you start, it's the earliest you could have started, then it's already better outcomes that you're going to get. So parents need to understand it's not a waste of time to go to therapy. It's not a waste of money because they always think, go lazy. Like we're in cahoots with the schools and we just want to make money out of this. A lot of us are really passionate about what we do. And we really want children to exceed, and learning is based on the foundation of language. People don't understand. I think it's because of lack of understanding. How does learning occur? You learn through language. So which language you use, and that's why back in the days the issue of bilingualism was a big one. Because firstly, you have to choose which language does your child use as a language of learning. Remember now, if your child's language development is delayed, so by age 5, if at 4 he's not speaking well in their first language, Zulu. Or nowadays, sometimes even a black child could have a first language of English. But if they are not competent in that language for academic purposes, they will not achieve. Not because they're stupid, but because their language skills are delayed. So when a teacher gives an instruction, they don't understand the whole instruction, they understand half of it. Or when they read later on, they have difficulty understanding what they're reading. So it's very important to have a good basis of language. It's very important to establish a major, or let me say, or to decide on correctly on the language of learning, or L1, what we used to say, the first language and the second language.
Yeah.
It's not just about wishful thinking, which I think this is the mistake a lot of parents have. So when you have to choose a second additional language, are you choosing English or Zulu? Like, it's like we're just guessing. We don't understand why do you have to choose correctly. Because learning occurs with the tool of language. The brain needs language to learn. So you have to have good language skills as a foundation, and you have to express yourself and understand and read and write in that language. So parents need to really pay attention to that. And in bilingual or multilingual context, we really have to teach children or give them an equal opportunity to learn both languages. Or as many languages as they can while they're still young. Yeah. Children's brains are like sponges. They can consume a lot. If I try to learn French now, it's going to be a disaster. But if you teach a 3-year-old,
they can try and get it. Yeah.
They will learn it. So we have to expose children to as many languages as possible, but there's a method to how you teach them. And it's important to have a speaker stick to one language. For instance, if your child is in an English school, then you speak English to your child, but Ugoko speaks only Zulu to your child, so your child will still learn Zulu, and they are still learning English. They are developing in both languages at the same time. Any child can learn 2 languages.
I think it's a beautiful conversation, and I think this interview will help a lot of people, because like I said, it's a conversation that is had and it's just passed over. That it's in the family or it's growth, and we don't actually understand the implications. Not even just the implications, that there are solutions to it. I want to find out, you've lived your life. You've lived your journey. You are passionate about what you do. You are resilient about what you do. What would you say to a young woman who's watching Dr. Mazibuko now? And like you said, obviously the backgrounds will never be the same. The struggles that they had, this generation has, and then you had, are very different. Society now is quite complex. The things that teenagers consume is not as exposed as your generation would have consumed, you know. Unfortunately, education is no longer looked at as the catch or fun or exploring the paths less taken. Like you said, your field in speech and audiology, there's still not an influx of people rushing into that field. So what would you say to a young woman who looks at you, who's like, I'm interested now in finding out about speech and audiology, but more than anything, I want to study and achieve the accolades that she has achieved?
Well, I would definitely say to any young woman, anything is possible. Everything is possible. Everything is possible. Definitely, if you have a dream or you're thinking about a certain career, find out what exactly it entails. I think finding out is not enough, actually. Ask for an opportunity to observe. Because when you shadow somebody in their daily job, you really get to understand what skills are required for you to do that job. So definitely any young person, male or female, who wants to study in a certain career needs to shadow somebody.
During the holidays, during the
definitely observe before you apply for something you have no idea what is involved in, and who the recipients are, like the target population for my work. I don't just work with children, by the way, but mostly it's children because they make them the majority of the patients, the customers. But I also work with adults and very old people. So you need to have patience, and you need to like working with children. You can. There's no other way about it. So if you're like, I don't like babies, I don't like dirt, and if you want time to, you have to understand what does it ask from you, apart from just the professional checklist. But in your heart, what does it ask from you? What does the job requires from you? a lot of sacrifice, time, and and you have to understand where you make your money, because it's not about money in some professions. Any work should not be about money. Even if you are passionate about teaching, then money comes because you're enjoying teaching so much, and people are asking you to help and help and help, and then suddenly you have another business of tutoring because you love teaching so much. Yeah, well, that's how it works. So money should not be a motivation for any career choice. Okay, it certainly helps.
Yeah, definitely.
That it pays well, but it should not be the motivation. It really should be about your personality and what works with you. And unfortunately, a lot of young people are not equipped to understand their personalities when they are 18. You don't really, even I remember when I was that young, I didn't know who I was. That self-awareness really comes from observing closely other people, talking, having a mentor, having somebody to constantly ask silly questions about life, and definitely having some level of reading. And nowadays you can research anything and Google, but especially now, I think it's important to have human contact more than AI and Googling. There are things you cannot learn from TikTok.
Unfortunately, as much as we'd love to try, but you
need to have contact with people. You need to go observe. You need to read more in depth about certain things.
Thank you so much. And I think every young lady, and unfortunately, what you just said would resonate to every young person right now. And I think those are the stalwarts that we want to look towards, I'm thinking as you guys started the path, unfortunately at your time, you did not have people you were looking at too directly. This generation now has you. My last question I have for you today is, looking at your past life, looking at how you grew up, looking at the cold winters of Emadadeni, looking at you skipping the grades, looking at you making those leaps into a new environment, seeing yourself studying, living your life, continuing, getting your doctorate, and all that you have achieved thus far. Do you still think in the next 25 years, is there something that you say, I personally still want to do because I feel I'm called to change the thought process or the understanding people have towards this field?
Definitely, funny enough. And there's always something I can still do. I'm laughing because just a couple of months ago, I was thinking to myself, hey, maybe I can register for another doctorate. Why not? I can still achieve it. It takes 4 years. Or 3 if you really focus. So there are still a lot of opportunities. There are still things, the more you learn, the more you realize how much you don't know. So I'm overeducated in just one aspect of my profession. There's still a whole lot of things I don't know about research, and I love research. That's my future. So I'm planning for retirement, and I'm planning for an active retirement. So I need to think now, what am I going to do for the next 20 years? And it won't be active clinical work like what I'm doing now. I want to focus more on research, and so I want to sharpen my research skills and do epidemiology or something like that. So there's still definitely more contributions. I tutor students now on the UKZN students on their community-based block when they come to Gwelezan. And I see a lot of opportunities still of teaching and making things practical and helping them integrate information. There's still a lot we don't know. And now we are challenged by AI and all these technological advances. And our field is very much threatened by that. And people who haven't realized that are living in a dream. Because you have to look at your career and be like, okay, in a few years' time, how will this be affected by
Affected.
AI? And I know my field is definitely going to be affected. So I'm thinking, how do I adapt again? I have to adapt how I do things now, how I practice, what I incorporate into my practice, so I'm ready for when people don't need to come to me and they just consult on the iPad.
Yes. How do you make it work?
How do I make it work? How do I make a living? Then what is my job? So I have to now also relearn again. So there's always a learning opportunity. We're always learning.
Thank you so much, Dr. Mazibuko. This was very informative, and I think a lot of our viewers at home have opened up their minds to saying that it does not matter where you started, the struggles that you have within, turn those into something that will drive you. And I have a feeling we have not heard or read about the last of you.
Definitely.
Ladies and gentlemen, thank you so much for tuning into The Top Woman. That was Dr. Mazibuko as she explains the world of speech and audiology. And she has achieved a lot, and may this be a path that many other women follow and change the world. My name is Zama King Neklo, and this was The Top Woman Podcast.